Hello, I'm Robert De La Garza, and I chose amyotrophic lateral sclerosis, or ALS. ALS, also referred to as Lou Gehrig's disease, is a neurodegenerative condition that affects the brain and spinal cord motor neurons. It impairs speech, breathing, swallowing, and walking, and other voluntary muscular movements, which are controlled by these motor neurons. And then those are the symptoms, which include muscle twitching, often arms, legs, or tongue, muscle weakness in the hands, arms, legs, or speech muscles. I chose the drugs Riluzole, which is brand name Rilutech, drug classification glutamate release inhibitor, and they extend survival slightly, typically by a few months, especially in earlier stages of the disease. The other drug I chose was Edaravone, which the brand name is Radicava, and may slow the decline in physical function in some people with ALS. It's a free radical scavenger, which is also an antioxidant, and it's manufactured by Mitsubishi Tambi Pharma. Riluzole. One important neurotransmitter in the brain and spinal cord, glutamate, is inhibited by riluzole. Excitotoxicity, a process where too much stimulation of nerve cells result in neuronal destruction and death, particularly in motor neurons, is considered to be caused by excessive glutamate in ALS. The main objective is to delay the course of ALS, particularly in the early stages of the illness, and then targets underlying neurodegeneration as opposed to the particular respiratory issues or muscular weakness. And then Edaravone, as a free radical scavenger, Edaravone aids in elimination of reactive oxygen species, which are the source of oxidative stress. It is thought that oxidative stress harms motor neurons in ALS, accelerating the course of the illness. The main objective is to slow the loss of physical function, especially if treatment is initiated early in the illness. And then the goal is functional decline as measured by instruments such as ALS Functional Rating Scale. How the drug is commonly administered. Riluzole is administered in tablet or liquid form. Edaravone is administered initially in IV infusion or in oral form. Common side effects associated with these drugs. Riluzole, typical adverse effects: feeling queasy, lightheadedness, fatigue of weakness, reduced lung capacity, headaches, increased ALT and AST AST levels in the liver, along with abdominal pain. Edaravone, bruising and abnormalities in the gait, headaches, dermatitis, inflammation of the skin, constipation, respiratory issues such as coughing, shortness of breath, etc. Drug-to-drug interactions. Riluzole, CYP1A2 inhibitors, CYP1A2 inducers, theophylline, caffeine, and clozapine, which are anticoagulants. Few nutrient interaction. Riluzole absorption is significantly reduced up to 20% by high-fat meals. Foods and drinks that include caffeine may have more adverse effects because of the common metabolic pathway. Edaravone drug-to-drug interactions. There is currently little proof of significant drug-to-drug interactions, and Edaravone has a lower risk of interaction because it's not metabolized by key CYP enzymes. However, keep an eye on patients taking corticosteroids or immunosuppressants or those with numerous illnesses in addition to other infusion drugs. It contains sodium bisulfate, which can trigger allergic reactions, especially in individuals with asthma or sulfite sensitivity. And in summary, ALS drugs overview slide the typical medications, which are glutamate release inhibitor Riluzole, and Edaravone, which is an antioxidant that scavenges free radicals. Action mechanisms: Riluzole slows down motor neuron deterioration by lowering glutamate activity. Edaravone slows functional decline by reducing oxidative stress. Principal adverse reactions: Riluzole, fatigue, nausea, and liver damage. Edaravone, headache, bruising, and allergic responses. Interaction between drugs. Riluzole interacts with CYP1A2 medications such as coffee and ciprofloxacin. Edaravone, few interactions. Keep an eye out for sensitivity to sulfites. Food and nutritional effects. Take Riluzole on an empty stomach. Avoid caffeine and high-fat foods. Edaravone contains sulfites. No known dietary interactions. And then the reference list. Thank you.